Currently, there is no cure for polycystic ovarian syndrome, making it a lifelong chronic condition. So, if you have PCOS, have you ever wondered, will symptoms get worse with age or during the phase of menopause? Well, let's talk about it, starting with the ovaries. So, cystic ovaries are a common feature in PCOS. In menopausal women, this feature is less likely to continue. So, irregular periods are another common feature of PCOS. And as women age and approach menopause, menstrual cycles become more regular and ovulatory, so the woman can become pregnant. Also, hormonal imbalances is another feature of PCOS. So, with age, androgen levels in the blood decline for women with PCOS. And this decline actually starts after the third decade of life. So, androgens are simply male pattern hormones like testosterone, which can be elevated in women with PCOS. So, now let's talk about the other health issues linked to PCOS and how they impact women in the postmenopausal phase of life. So, type 2 diabetes is a health issue linked to PCOS. So, though the evidence is limited, studies suggest that women with PCOS who are approaching menopause or they're already menopausal, the likelihood of developing type 2 diabetes appears to be connected to obesity. Obesity that started somewhere around the third decade of life. So, another health issue linked to PCOS is high blood pressure or hypertension. So, current research suggests that women with PCOS, as they age, the risk of hypertension related to PCOS actually declines. So, another health issue linked to PCOS is abnormal cholesterol levels. So, there have been very few studies um, done that have examined abnormal cholesterol levels in older women with PCOS, but the current evidence suggests that high triglyceride levels may persist in postmenopausal women with PCOS. So that's definitely something we have to keep an eye out for. So there is not a lot of research of the long-term health effects of PCOS on postmenopausal women. So there are different types of PCOS. So the long-term health impact, it may vary from woman to woman, depending on the type of PCOS she has. And I am going to do a video on the different types of PCOS in the near future. In the meantime, I would encourage you to continue or start to focus on lifestyle changes. Because just like polycystic ovarian syndrome, aging and menopause presents its own new set of risk. So manage your life, manage the level of stress in your life by doing yoga, meditation, or maybe taking up a new hobby, setting boundaries in your life. Also, stay active, exercise, weight train most days of the week. And I would also encourage you to not start as you age or not start when you're older. Start in your teens, in your 20s. Start young before the damage occurs. Also, you want to stick to eating a non inflammatory diet because we know that PCOS is a low chronic inflammatory condition. So we want to avoid things like fast foods and, try to cook at home if you can. Also, take vitamins and supplements for your health and wellness gaps, as well as supplements specifically made for women with PCOS. Finally, stay up to date on annual screening to prevent and catch health conditions in the early stages. Thank you.